Good morning, good afternoon, or good evening, everybody, and welcome to the 9th Conference, National Society for Evidence-Based Healthcare. It gives me great pleasure to welcome you from Riyadh, the capital of Saudi Arabia. Riyadh is a vibrant city, and it has changed a great deal in the past couple of years. It's no longer the city that I used to know, and that is in a positive sense. It becomes so rich, so diverse, and so full that you would find it amazing. And anyone who has visited our capital city, Riyadh, they would really find it amazing. That's the key word for it. It is heading towards becoming a cosmopolitan city, and the focus is on what works and on people who can deliver. The leadership of Saudi Arabia had a vision that Riyadh will be a cosmopolitan city with a huge society, and along with the infrastructure of a modern city, you will enjoy the historical places, the cultural events, the recreational events, and so on. It's a huge transformation that we've been going through, and which made it, again, I would say, an amazing city. It follows that this conference should have the same spirit. It should be an international conference, but having the flavor of the country that is hosting the conference. It should be amazing. It should meet the needs of a diverse audience, and it should focus on impact, makes use of the history and from the lessons learned, and build on previous achievements and gains. And that was the guides that we use in order to build this conference. So we just to make sure that all the audience, and I'm really glad to see you all here, so many familiar names and so many colleagues from all over the world, just to make sure, and so many juniors as well. So to make sure that we are all on the same page, this is the definition, the simple definition of evidence-based medicine or evidence-based healthcare, which is a style of practice in which decision makers refer to valid and relevant information. Valid in the sense that it is accurate, and relevant in the sense that it is in the right context and related to patient or society-oriented outcomes that matters. Although David Sackett has been known as the father of evidence-based medicine, and in fact, no one will forget his huge contribution to the journey of EBM worldwide, to the extent that there has been a prize that after his name, which was awarded to Sir Ian Chalmers for the first time in 2019, and that was in Sicily, and then everything was locked down. So no one can deny the input of these gurus of EBM, David Sackett, and Ian Chalmers, and many more. But when you search for evidence-based medicine in PubMed, you would find that the first time that it was mentioned was in an article that was published in 1992 in JAMA. And the authors were people that you know and people that you would listen to, which the main author was Gordon Guyatt. In fact, this is the first time that evidence-based medicine became an entity or a concept that people would refer to. And at that time, this movement towards evidence-based medicine came as a result of large and unjustified variation in clinical practice and significant levels of inappropriate care, and evidence of over-medicalization and treatment-induced ill effects on health. And you can imagine the cost that has been related to all of this. The first decade of EBM focused on the methodology, on the concept, the basic methodology, the steps of EBM, and the like. And of course, in parallel to that was the development of the Cochrane collaboration after Archie Cochrane, but the development was pushed in the main place by, say, Vice Chair Ian Chalmers. And the EBM movement was considered a disruptive technology. It's a new way of practicing things. It was radical, it changed the standard practice, and it was an aim to democratize decision-making by making evidence available to everybody. The second decade focused on tools, how to make pre-filtered evidence and how to make things handy and able to be put in practice. And that there was the development of a lot of the ESE's approach to the sources of evidence, as well as so many tools, evidence matters and essential evidence plus, and a lot of tools. And there has been a movement towards focusing on individuals learning the skills of EBM towards implementing it at large. So rather than using the 5 steps approach, it was more to use on evidence-based guidelines, clinical practice guidelines with standards that came out from the what used to be called the Institute of Medicine, or from GIN standard, the Guidelines International Network. But the third decade that we live in has focused on implementation, how to move from what you know into how to do it and how to put it into practice and into policies. There are so many frameworks for putting things into action, but this is probably the most famous one that has been developed by the Canadian Institute for Health Research. And of course, the development of the GRADE and the GRADE methodology, GRADE Pro, and the development of the evidence ecosystem and the living guidelines. And I'm really happy and proud that you're going to hear a lot about these concepts in this conference. So that helped us in identifying certain themes related to these important aspects of evidence-based healthcare. When we put evidence or EBM or evidence-based healthcare in a global context, all countries are moving towards providing universal health coverage, are committed, have made a commitment in 2015 towards achieving the 17 goals of the Sustainable Development or the SDGs as they are known. And you know all that health is part of all these goals. And therefore, in order to make health supportive for this, the shortcut, or hopefully the shortcut, would be to focus on evidence that really matters in order to deliver and in order to achieve these goals and meet the KPIs that were identified. The challenge for all countries is to make healthcare, a very costly healthcare, make it sustainable. And in order to be sustainable, it has to be value-driven, effective, affordable, fit for the future, and leaving no one behind, the so-called universal health coverage. How can we make all this, and how can we feed evidence into achieving these entities or these objectives or these criteria for sustainable healthcare is part of the conference as well. And always people tend to think of so many aspects of health, but they forget the elephant, which we are talking about today, which is evidence-based medicine for short, or evidence-based health care. When we talk on larger or at the macro level, these are the 3 circles that many of you would remember in order to provide individual or clinical care, where you integrate the best available evidence with the patient's values and expectations and the expertise and this is the point where these 3 elements join is EBM. When we talk about public policies, which is badly needed, and we hope that the evidence organizations would be able to engage more in making public policies, again, focus on the evidence base along with the social strategies, which is in a way similar to the patient's values and expectations, and the political will, which is in a way similar. We can make an analogy. It's not exactly similar to the clinical expertise. So Evidence-based medicine or evidence-based policy making is in a way similar to EBM, but it is different as well because so many other components get in. And that's what stimulated us to have a theme that is related to evidence-based health policy, because we think that this is related to the future of EBM, the future that we would like to see. And the WHO has made an effort. I'm sure people from the WHO headquarters or from WHO EMRU would talk to you about this summit and about the efforts that are made even at the regional, the East Mediterranean regional office, in order to build institutional capacity and make it a reality, in the sense that all countries would have clinical practice guidelines. And in fact, I'm participating with them next week on a meeting, a seminar on how to create case studies for all countries of all walks of, with all the diversity in our region as well. Other speakers will talk about the Evidence Commission report and how to address the societal need, and that would come to you again in another keynote speech on day 2. We all know that COVID-19 has hit every aspect of our lives, and it was the test for the credibility and to what extent evidence-based healthcare is a genuine concept and is able to deliver. And you would hear about this. There is a theme, which is the first theme, is about developing evidence for COVID-19 guidance and what are the pros and cons, how the media and journalists coped with this, what about guidelines, and many more. This conference is timely in the sense that it coincides with the third decade, the end of the third decade of evidence-based healthcare. Remember that the first paper by Gordon Guyatt came out in November 1992. We are October 2022, so it's 3 decades. And what's more is that it is the third world evidence-based healthcare, and that has been stimulated by COVID-19. The pandemic has its pros and cons. We have learned a lot. So it was a lesson that the whole world learned, that we need to rely more on evidence, and that the October 20 became the World Evidence-Based Healthcare Day. The theme of the first conference was on impact, more on impact more from evidence to impact, and this is where we borrowed the title of our conference. The second one in 2021 was on the use of infodemics. It was a new term, and that is about the information and that went in parallel with the pandemic that we had, with all the good and the bad things about it. And the third World Evidence-Based Healthcare Day that we are celebrating in 2 days is about partnerships for purpose. And nothing exemplifies the partnerships as this conference. This conference has many parts. Of course, it's the conference of the International Society for Evidence-Based Healthcare, but it has 3 hosts that are interested in evidence-based healthcare in Saudi Arabia, which I'm going to touch on in a moment. The sessions are delivered by also GIN, the Guidelines International Network, sorry, the Cochrane Library. Of course, the host is King Saud University, the College of Medicine and Medical City, and King Saud University in general, represented by the Bahamdan Research Chair for Evidence-Based Healthcare and Knowledge Translation, the Saudi Health Council, represented by the National EBM Center, and the WHO, whether we're talking about the headquarters or we're talking about the East Mediterranean Regional Office, which in fact has been very supportive to our conference by delivering more than 1 session about a keynote speech, developing policy briefs, and many more. So I'll probably give credit to the hosts, the King Saud University, represented by Hamdan Research Chair for Evidence-Based Healthcare and Knowledge Translation, which is led currently by Professor Amr Jamal. This research chair was founded in 2008, and I was leading it till 2018 when I joined the WHO. And Professor Amr Jamal is keeping up the good work, I would say. I'm not biased, but I think it was good work that we have done, and that continues to go on. And also by the the Saudi Health Council, represented by the National EBM Center, which is led currently by Dr. Muhammad Al-Saidi, and by the Virtual Medical Academy, which is led by Dr. Khalid Shahat. They decided to support us with no limits and no conditions, and that was so nicely done. And we were proud of them. We wanted them to be our host because we want the world to see that we have a virtual conference platform that is capable of delivering. So it is an international conference, but with a Saudi touch, I would say. And I would like to thank all the members of the conference committee. They have made an immense contribution to developing this conference. Gordon Guyatt, of course, is well known, as well as Kameshwar Prasad. They are the co-chairs of ISEHC, and they will be talking to you soon. I would like to thank Dr. Lamis Al-Watban for leading Team 1, which is about COVID and the evidence to support the management of pandemics. I would like to thank Dr. Ghada Bawazir for leading Team 4, which is about living evidence and living guidelines, the ecosystem, all these sessions that you're going to see soon. Dragan Elik, along with David Nounan and Luay Al-Barkuni. In fact, Luay Al-Barkuni is the one who led the Team 2, which is about education and learning in evidence-based healthcare. And I would like to thank Eddie Lang for leading of Team 3, which is about prevention of overdiagnosis. I would like to thank Yusuf Al-Amri on behalf of the Saudi Health Council for leading the theme of regional experiences and lessons learned. Taryn Young and Susanna De Silvia for leading the 5th theme on evidence-based policy making. And of course, I wouldn't forget those who have supported us. Saud Al-Gbaisi, she has done a phenomenal work, and she's still doing. She will be following this conference with tweets. Mr. Muhammad Jamal and Mr. Badr Ruwaili, along with Ms. Hind Rumezan. So all of them, these 4 were fantastic. So I would like to thank all of them. I would like to thank those who have participated with us, but who they couldn't make it for one reason or the other. They have left the position, or they have moved to another institution, and so on. The last point I would like to talk about is about the representation. Talking about speakers, we have speakers, 55 speakers. That's excluding those who have apologized and who couldn't make it. We have 55 speakers from 20 countries. And this map is so nice to represent the diversity of input into this conference. And the participants, as of yesterday, we had 360 people who have signed up for this course from 24 countries, but I believe that there are more on the way. So I'm going to probably with closing, either Professor Paul Blasio or myself are going to brief you with how many people have really signed up, and probably from more than 24 countries. But I would like to thank the first one who signed up for the course immediately when we announced for it, Professor Ahmed Mandil. That was so nice of him. Although he's a speaker, probably he didn't need to register, but he was the first one. And I thought that we need to say well done and applause to him. So the schedule at a glance, there are 20 sessions distributed over 2 days. And this how the sessions are distributed, varying from plenary sessions, panels, discussions, debates, and tools, and so on, workshops, of course. And then when we talk about the themes, and this is the distribution of topic of the sessions according to the themes, and we have added three sessions on tools that because we believe that people, although they want to know things, they want also to experience. So we managed, despite the virtual nature, or probably because of the virtual nature of this conference, to make a hands-on session, so that you would want to attend and participate. We have made it in a way that it will be round-the-clock sessions. So when you look at the schedule, we know that there are sessions that fit very well with your time zone, but there are sessions that are out of your time zone. But that's fine, because these sessions, we wanted the involvement of all speakers from all over the world, and these sessions will be recorded and will be available for you to watch and rewatch for 2 months on the website of the conference at the Virtual Medical Academy. What's more, we are celebrating today that ISEHC, as a result of this conference, has become an evidence ambassador to the third world evidence-based healthcare. So we wanted, at the beginning, I wanted to tell you to keep tweeting about the conference, or maybe you want to use the LinkedIn or whatever, using the hashtag of the conference, as well as the mentioning our Twitter account. But now maybe you need to mention this as well, because we are, the conference committee on behalf of ISEHC is, and also all the participants are now ambassadors for the World Evidence-Based Healthcare Day. And if you go into, just this morning, I didn't have time to add it to the slides. If you go to the link of the World Evidence-Based Healthcare Day, you would find ISEHC logo. And I'm so proud of this. In fact, one thing I would probably say here, that the ISEHC logo was developed in Saudi Arabia as well. That was a few years, maybe a decade ago, when ISEHC was founded in 2010. And one member, maybe it's nice to mention him and pray for him as well, Dr. Mahmoud Al-Barbari, was a member of a founding member, and he's the one who volunteered to work on the logo of this one, the logo here. And this logo now is available on the World Evidence-Based Healthcare Day. So it's another example of impact. You put the seeds now, build on it, and nurture it, and it will build it by itself and pay, even if people are no longer here. So we hope that this conference would really focus on providing the main logo that we were after, and that is the impact, and that we would still invest in evidence generation, but we would move into impact, implementation of evidence, and evaluation of the impact of this implementation. I hope you enjoy the conference. I hope you enjoy the next coming 2 days, and that it will be the beginning of a launch of evidence-based healthcare that is stronger and more impactful. Thank you very much. And I'll stop here and hope that you really enjoy what we have made the effort to deliver to you in an impactful way, I would say again. Thank you very much. And stop here. One more thing that I would like to focus on is to use the chat. There will be time, the chat feature is always available. So please make the effort to introduce yourself, talk to others, and maybe that would be the beginning of a networking that will deliver impact as well. Thank you very much.
Hello, I'm Gordon Guyatt. I'm a professor of clinical epidemiology and of medicine at McMaster University, and I'm here to be one of the people to welcome you to the conference from the International Society of Evidence-Based Healthcare, which we are holding today and tomorrow. The Society for Evidence-Based Healthcare began as the idea of Kameshwar Prasad, a leader in EBM education from India, a neurologist who'd been working in EBM for 20 or 30 years at the time we got started. Kameshwar identified the fact that there were many people worldwide interested in advancing EBM education, learning more about it, learning about innovations, supporting one another. And there was no organization available to facilitate that. And ISEHC came about as Kameshwar's brainchild to achieve that goal and has been working toward it for just about a decade now. The current conference, which is very exciting, is being organized by Lubna Al-Ansary and her team from Saudi Arabia. It's really a really extraordinary job that they've done with organization. And I'm going to tell you a little bit about that. And I think it will become evident to you the extraordinary job that they have done. We intended this as a worldwide conference. Lubna and her team intended this as a worldwide conference. And how then do you deal with different time zones? As it turns out, the solution is a round-the-clock offerings tailored to many different time zones around the world so that people in over 20 countries can join and take advantage of the conference. So simply organizing the logistics has been a big challenge that Lubna and her team have accomplished. The other huge accomplishment, in my view, is the remarkable program that Lubna and her colleagues have put together. She has over 50 leading EBM educators, pioneers, and innovators who are participating in this. I'm going to only very briefly highlight some of the sessions that appeal to me particularly. Ones that appeal to you may be quite different. And I suggest that you look carefully through the program and you are certain to see a number of offerings that you would find informative and highly educational. One that I will mention is by Per van Vijk, a Norwegian leader in evidence-based healthcare involved with the Making Grade the Irresistible Choice or MAGIC Foundation. And people over the last years have understood that one way to think about EBM worldwide is in contributing and leading in what one might consider an evidence ecosystem that goes from the generation of new evidence through systematic reviews, through guidelines, through putting guidelines in electronic formats so that people could access to them, and then assessing their impact. And Per is going to talk about the evidence ecosystem. In recent years, overdiagnosis has become a major issue, and EBM has focused on addressing issues of overdiagnosis. One of the world leaders in that area, Eddie Lang, will be addressing that issue. It's related to policy making and value-based healthcare. And one of the great things about this conference is it's about EBM teaching at the front line, and it's also very much about policy making and broader issues around policy making. And Jeremy Grimshaw, in a session focused on value-based healthcare, is going to be one of the people addressing that issue. I can't resist telling you about a session that I'm going to participate in, which is going to address controversies in evidence-based education. So the position I am going to take has to do with a decreased focus on critical appraisal in the sense of risk of bias, that I think we should be doing and turning our attention to getting clinicians to understand and apply the results that they get from pre-processed evidence. Paul Glasio agrees with me to a considerable extent, but is also, I think, going to provide something of a different perspective. And a final session I'd like to highlight is Dragan Ilic has been a leader in developing evidence-based healthcare resources for online education, because through COVID, clearly, we have had to shift to a very large degree on online education. As we move into the post-COVID world, that will be less of a necessity, but I think we've learned about some of the merits of virtual education, and Dragan Ilic will be able to tell you how to do it well. So once again, ISEHC has a central role in linking evidence-based educators and practitioners from around the world, and Lubna Al-Ansary and her colleagues have come up with a great program for you for the conference. I hope you enjoy it.
Well, thank you very much, Professor Gordon Guyatt. I believe that Gordon is so well known. He's the one who coined the term evidence-based healthcare, and he didn't need to introduction because he's so well known. And the floor now is Professor Kameshwar Prasad. He from India, who has made a great effort in promoting evidence-based healthcare there, and who is the co-chair of ISEHC, the International Society for Evidence-Based Healthcare. So welcome, Kameshwar Prasad.
Welcome, everyone. I, as President of Indian International Society for Evidence-Based Healthcare, I welcome all of you. I am Kameshwar Prasad. I am a neurologist, but at present, Director and Chief Executive Officer of a medical university called Rajendra Institute of Medical Sciences in eastern part of India, in a city called Ranchi, capital city of a state called Jharkhand. I worked in Delhi for 40 years in All India Institute of Medical Sciences. And after superannuation from there, I have joined this place as Director and CEO. My interest in evidence-based practice has been there since 1992, when I was doing a master's degree in clinical epidemiology at McMaster University, Canada, when I had privilege to meet Gordon, and we remain friends since then till date. I would like to emphasize few points why this annual conference is important. As Gordon has told you, that I realized that while a lot of activity is going on in Western Hemisphere in high-income countries, and I was teaching in Oxford University workshop also, and McMaster University workshop also. So I was invited 1 year, 2nd year, 3rd year. Then I started thinking that nothing like this is happening in low and middle income countries. So to allow people to get oriented to this evidence-based practice, evidence-based healthcare, I talked to Gordon, talked to Paul, who was then director of the Center for Evidence-Based Medicine in Oxford University. And I'm very grateful to them that they agreed to join hands and develop what is still a developing International Society for Evidence-Based Healthcare. Why is it important for low and middle income countries? You know that resources are limited, but resources are wasted at the same time. We did a prescription review of more than 200 patients and found that after ischemic stroke, 50% of patients are prescribed neuroprotective drugs for which there is no evidence that they make any difference. So a lot of money is wasted. When I sent this paper for publication, they said, can you calculate the annual expenditure on these ineffective medicines? And we did that exercise through some market survey. I can say millions of rupees, maybe billions are spent on ineffective medicines. Whereas effective medicines, as simple and as inexpensive as aspirin, was not prescribed to 50% of the people who carried the prescription. So I called it a pathetic prescription paradox, where 50% patients get ineffective medicines. On the other hand, 50% don't get simple and effective medicines like aspirin. So there is a need for evidence-based practice in developing countries. It is not going to happen without the help of people and places where this is very active. So one of them is, of course, McMaster University. Then there is Oxford Center for Evidence-Based Practice. Now there are such capacities also in many other countries, but we need to assemble that expertise and also involve developing countries so that it gets disseminated everywhere. There is a second reason why it is very important. Many of the physicians used to be, now in developing country, I still come across, they are not up to date. And one reason is there is so much literature that handling that massive load and then still remaining up to date is a skill which needs to be inculcated. That is what lifelong learning skill is. But how do we do it? How do we do it are the key steps of evidence-based practice. Ask a question, or at least formulate a question which arises in your practice, search for evidence, look for the results of pre-appraised resources or do a critical appraisal, and then apply that in clinical practice. Now, this is not happening. Even if they don't do critical appraisal, as Gordon said, at least they should be able to read evidence-based guidelines, identify it, that it is evidence-based. They should be able to recognize a good guideline and interpret and use it in their clinical practice. This is grossly lacking, and therefore a lot of practice. As CEO, I signed something called tranexamic acid for so many departments, 20,000 injections I signed for a month, and then asked where are they using it. They are using it also in medicine. I said, for what? I went to medicine department. They said we use it for presumed active bleeding, suspected active bleeding. Most of them are chronic liver disease and varicose bleeding. But actually, there is no evidence now that they should use it. They were not aware of it. So this type of activity is much more necessary in low and middle income countries. There are many other reasons. I'm not going into the details, but I think I must thank Dr. Lubna Al-Ansary to host this conference. They have done a great job, and must thank all the members of the ISEHC board who have agreed to let Lubna host this conference. She has done an excellent job, and this is an example how evidence-based practice can come to developing country and be useful in so many ways. I have only cited few of the ways in which it can be useful, but I think as an educational strategy, it is very important. As improving quality of care, very important. Also improving education. This is so much more about education and not to underestimate that it spurs research. The moment people start finding out gaps in knowledge, gaps when they start reading guidelines, they also find research questions which are pertinent to their practice. And this, believe me, is a good way to stimulate research in developing country institutions. So these are the basic reasons why I thought that we must have International Society for Evidence-Based Healthcare and have rotating conferences. And I was privileged to host the first one. You have heard from Gordon, but it is happening regularly, except for 1 year during COVID time. But we will have it, even if it is virtual, certainly every year, where opportunity will be there for developing country participants to learn what is happening and to adopt and adapt what is good for their country. Thank you very much. I wish you all the success through the conference, and I wish you enjoy all the presentations. You have already heard about various themes which are very, very relevant, very much timely, and particularly in COVID time, one has seen how important it is to think about evidence-based practice and practice what is evidence-based. Thank you so much. And I wish you enjoy the whole conference.
Okay, thank you very much, Kameshwar. It takes leaders or champions, I would say, in order to start to make the change. And it was clear that he was a champion or the champion in India for evidence-based healthcare. But I'm also confident that all of you here who are watching and who are participating in this conference are champions, and you will make the change and the impact that everyone desires and aspires for. The final talk would be by Professor Yazeed Al-Shaikh, who is the Vice Rector for Graduate Studies and Scientific Research. And so welcome, Professor Yazeed Al-Shaikh.
بسم الله والصلاة والسلام على رسول الله وعلى آله وصحبه ومن والاه. السلام عليكم ورحمة الله وبركاته. It is an honor to welcome the 9th Conference of the International Society for Evidence-Based Learning to KSU. We are very happy to host this prestigious conference. It is also noted that we are at King Saud University reviewing all our processes based upon impact. And I know impact in healthcare systems and healthcare studies is an important factor. King Saud University now wants to be a regional player in terms of the policies and procedures regarding healthcare and healthcare services. So this conference comes at a great welcome and with great timing. So it is our honor to host this conference, and we hope that all of the delegates have a very fruitful time, and that I'm sure that all of the presentations are worth listening to. I wish I have the time to attend most of them, but I will try to tap in to what I can and what time serves. King Saud University is now an independent university under the Royal Commission for Riyadh City. Therefore, all of its processes now are reviewed to help and to guide all scientific, social, economical, and health services within Riyadh and the greater scope in the kingdom. So I welcome you again, and I would like to take this opportunity to thank all of the participants. You are most welcome to our university in this virtual setting. I would like to thank the International Conference, or excuse me, the International Society for Evidence-Based Healthcare. I would like to thank the Saudi Health Council for participating effectively in this conference, the WHO and SABR and all its subsidiaries that are relevant to this conference. I would like to thank also the chair on evidence-based learning, the Baham chair for evidence-based health practices, and Dr. Lubna for her continuous activity and support and her impact on our practice here in King Saud University. Thank you very much and wish to see you soon.
Okay, a nice talk from the Vice Rector, Professor Yazeed Al-Shaikh. And this concludes the opening part and the formal part, I would say, and the real work is starting soon. The next session will start in 9 minutes on living evidence. The title is Living Evidence, Bridging the Gap and Enhancing Evidence Supply, which is a plenary session led by Sir Mike Clark. But I suggest that you don't waste time, make use of these remaining 9 minutes. And I was so happy and excited to see people participating in the chat. I've seen Dr. Ahmed Saqar, Zohra Mahmadi from Tunisia, Ghada Bawazir, and then Aisha Khzemi, and the Hiba Ghanim, I hope I'm reading it correctly, Randa Hamada, and Muhammad and Bender. I need to put my glasses. Sorry, I'm getting old, as you can tell. Bender Elanizi, Langilwa Lusu. I hope I'm reading the name correctly. And Roland Basrawi, Samia Ismail, Rugaya Turabi, and many more. Yes, make it an active, an interactive session as much as you can. So this is great. I tried to write something, but I think because I'm a panelist, I couldn't participate in this, but I'll get this problem fixed and enjoy the remaining, now I would say 8 minutes, and see you at 11 with the session, the first scientific session of this conference. Thank you very much.